Health Minister Dr Joe Paahla says government is prepared to deal with any litigation against the National Health Insurance Act. The Democratic Alliance says it's ready to approach the Constitutional Court to challenge the legislation. Now, President Cyril Ramaphosa signed the NHI Bill into law yesterday. Let's explain and verify certain issues around the NHI with Samkele Maseko. Samkele, good evening. Thank you for joining us. So the bill has been signed into law, making it also important to actually explain and verify many aspects of it. But before we get to the aspects of it, I want us to talk about the genesis of the NHI. Can you take us through it?
A very good evening to you, Mfundo, and to the view as well. It was a 2009 Education and Health Subcommittee study by the African National Congress led by Dr. Zwelini Mkhize, which eventually today led to this particular bill, which was introduced by the ANC to Parliament, now has effectively become to law. In this week's episode, the second episode of Explain and Verify, we will be fact-checking, explaining and clarifying why government saw it a need to introduce the National Health Insurance NHI. Yesterday, President Cyril Ramaphosa signed the NHI bill into law to much fanfare, much of which many were delighted, but leaving many stakeholders dismayed and disappointed. Without question, the South African health care scenario will undergo significant change in the near future. The government claims that the moment has come for the country to transition to universal health coverage, which will ensure everyone, regardless of income, receives decent treatment. South Africa has signed the United Nations Vision 2023 vision of implementing this national health insurance. The NHI aims to attain universal health care, which this sixth administration comes to a conclusion, has effectively signed the NHI bill into law, which was effected by a parliament, which in terms by the referral of the president and the government of the day is Ubuntu in terms of citizen health care throughout the NHI. This is the world's revered constitution, which states that access to health care is a further right to all South Africans envisaged in the National Development Plan, which will address access to private health care by those who may not be able to have the financial means to go to private institutions and are already within the public healthcare system, which services bulk of South Africans. Let's just listen to what President Cyril Ramaphosa had to say about the NHI.
In its essence, the National Health Insurance is a commitment to eradicate the stark inequalities that have long determined who receives in our country, who receives adequate health care, and who suffers from neglect. The real challenge in implementing the NHI lies not in the lack of funds, but in the misallocation of resources that currently favors the private health sector at the expense of public health needs. The NHI bill presents an innovative approach to funding universal health care based on social solidarity.
All right, those are the words of the President of the Republic, just stating there that it will be funding based on social solidarity. Very noble, but some say perhaps a little bit vague, so we all expect that the Finance Minister at some point will take us through the very basics of how this will be funded. But not to digress, talk us through what prompted the NHI.
Well, Mfundo, it's very interesting what the Finance Minister has to juggle with, particularly looking that he has to fund free education. He's got a limited base load when it comes to revenue collection from SARS, and he's also now has to fund the NHI, which will raise the question, will value-added tax be raised or not? But let's look at what prompted the implementation of the NHI. South Africa's healthcare system is two-tiered, with a huge, heavily subsidized public sector available to everyone and a tiny private sector that serves the middle, upper income people. Private healthcare is funded by individual payments. You and I, Mfundo, South Africans who are middle class, who are working, those whom have millions of rands within the bank as well, they particularly have those particular medical aid schemes, medical aid insurance. But let's look at some of the statistics of those who've got access to private health care within the country, Mfundo. If you look at the percentages, Overall, we've got 62 million South Africans within the country. 15.8% of South Africans have access to private medical health schemes within the country. That is a sum of 9.7 million South Africans in a country of 62 million South Africans who've got access to private healthcare. That speaks about the economic disparities that are there and the inequalities that are there within the country. But then look at the staggering figures. 84.2% of South Africans use the public healthcare facilities within the country at the moment, Mfundo, and that is a sum of basically 52.3 million South Africans that are currently within the public health care system within the country. Those are staggering numbers that you have to compare with, particularly with the implementation of this NHI. For instance, where I come from in Appelsbosch, it is about 90 kilometers to the nearest town in Tongaat, where you find a private healthcare facility. If you go the other route around, going to Pietermaritzburg, it is about 120 kilometers from my village, where you can find a private healthcare facility. But in between, there are public healthcare facilities which are not academic hospitals, Mfundo.
So meaning that even if you had the means to go to the private hospital, it's just too far away, so it becomes difficult nevertheless. But honestly, quite glaring disparities there, quite concerning, but one wonders, with the noise, because there have been a lot of detractors, many of them. But now when we look at the figures, it becomes more apparent that it's actually a small portion that is serviced by the private sector. But then I want us to look at the total GDP health expenditure. What does data show us there?
Essentially, when you look at the GDP expenditure, for instance, let's start with the demographics of the country, on how the demographics are represented when it comes to this particular issue of these particular medical aids. You go in 2001 in South Africa, white South Africa, 77.7% of South Africans in 2001 had access to these particular medical aids. You look at how the economy has performed across the board throughout all demographics. In 2022, 71.9% of white South Africans had access to these particular medical aids. Then you look at the drastic drop. 45.1% of the Indian and Asian descents within the country have had access in 2021 to these private healthcare facilities or private healthcare medical aids within the country. But with them, there was a slight jump to 48.7% in 2022 with access to medical aid within the country. But the colored community, particularly when you look at how mobilization is taking place within the country for these particular elections, it is rather around racial and ethnic mobilization. You look at the PA, which says it represents the colored community, which feels dejected by all political formations within the country and the government of the day. In 2021, 19.9 colored South Africans had access to private health care within the country, and a drop in 2022 of 18.2% of the colored population, which languishes in poverty in many large areas of Gauteng, KwaZulu-Natal, Eastern Cape, Northern Cape, Western Cape, and other parts of the country. Then you look at the black majority. The black majority, 9.3 South Africans.
The black
South Africans, 9.3. The black majority.
Emphasis on majority.
The black majority, 9.3%, had access to private healthcare. 9.3% had access to private healthcare. Then you go to 2022, performed fairly well. Some many black South Africans got jobs, 9.7%. It was a mere 0.4% jump for black South Africans to gain access to private healthcare within the country. And overall, 16.1% of South Africans in 2021 had access to private healthcare. 15.8%, a drop due to the bad performance of the economy. In 2022, South Africans had access to private healthcare. Now let's look at the overall expenditure when it comes to the gross domestic product, GDP. Very interesting. The private healthcare gets less. It's 3.7%. But the public healthcare gets 4.8% of the gross domestic product, GDP.
Yes.
Overall, of the South African GDP, 8.5% is spent on access to healthcare, private and public. And that will tell you of the revenue that the Minister of Finance, Kotongwane, has to play with when it comes to the dispersing of these rands and cents when it comes to healthcare for you and I, for Ugok Matingwana, who is in deep rural Zululand, for Ugok Chivenga, who is in deep rural Vembe, to get access whether to private or to public healthcare. But what was going to be rather interesting will be how much government spends on public healthcare. What is the budget that the government essentially spends on public healthcare? Let's look at how much the government essentially spends and pumps in on an annual year on this particular sector of healthcare. 271.9 billion rands is spent on healthcare, but 75% of it goes to paying our brothers, our sisters, our mothers, our grandmothers who work within this particular sector, of making sure they keep you and I in good condition, of making sure that poor South Africans get access to this particular health care. But only 25% is left for the operational costs to run these particular hospitals. And that is why you probably find many of these hospitals dilapidated, not properly serviced. 2 years ago, I went to Sebokeng Hospital to take my grandfather, who stays here in Gauteng, to hospital. Windows were not there within that hospital. Floors were not properly tiled within that particular hospital. As much as there is improvement, you've got proper services, academic hospitals like Chief Albert Lutuli Hospital in KwaZulu-Natal, top tier academic hospital, but many find themselves struggling.
And the context is here, that 75% of the money actually goes towards salaries and not necessarily the core function of the health service.
Indeed, it tells you of the discrepancies that are there, where you've got this 279 billion rands that is spent on, that is pumped into the healthcare system, where 75% of it goes to salaries. It essentially now brings about the point on why it becomes important for this particular rollout of this particular national health insurance, in order to make sure that ugogo that is in an urban area like Gauteng, who is in the Vaal, who's in Orange Farm, who's in Palm Springs, who may not get a bed at the Sebokeng Hospital, is able to go to a private facility in and around the Vaal Triangle, who is able to go to a private facility in around here in Auckland Park. I won't mention the hospital, but essentially it gives them that particular access. But someone who is in deep rural areas may not have that luxury of going to this particular private hospitals on the virtue of the kilometers of where they stay from. Let's take Tutwa as an example in the Eastern Cape. Far too secluded. Far too secluded. A hospital is maybe 160, 170 kilometers where you are from, which is a public facility. And in the opposite direction may be a hospital that is an academic hospital, but you still have to travel those particular kilometers. And in between that traveling, you may eventually reach your fatality and pass on.
But I suppose this is where the social solidarity funding that the president speaks of would come in, that if there's enough funds from both those who enjoyed medical aid and those who didn't, then what would happen is they would up the infrastructure in that hospital at Dutwa, at the very least.
Indeed, that particularly that infrastructure fund that the president is speaking about will certainly help. For instance, if you look at the data of the spend between public-private healthcare per capita spending, public healthcare facilities per person, 5,200 rands. Let's look at the private sector. Private healthcare spending per person, per capita, 20,000 rands. For instance, you go to a private facility, it will take you no more than 30 minutes to see a doctor. But you go to a public facility, it sometimes takes you a very long time to see a doctor. Sometimes you are even told you have to come back in the evening. You have to come back the following day in order for you to access this particular facility. But the NHI has been met with many objections here, Mfundo. There are those whom are sector players who've said, no, they are against this particular implementation of the NHI. You go to political formations, the EFF rejected this particular bill in Parliament. They voted against it. You go to the Democratic Alliance, they voted against it. The DA, through its leader, John Steenhuisen, has even said that it's unconstitutional. They are going to take it to the apex court in the land, the Constitutional Court, in order for them to basically make this law null and void. And the government of the day, President Ramaphosa, has had this particular bill on his desk for 6 months. He's taken 6 months to sign this particular bill. But let's listen to some of the stakeholders on what they've had to say on their objection of the national health insurance.
I think the frustration of a lot of stakeholders is that ever since the NHI process began, there has been extensive engagement in that process. There has been research and input given to the process of bringing this bill into law. And the greatest regret has been that this has not been taken into account. So we now are sitting with a piece of legislation which really does not reflect that engagement process or the input that was provided.
We're not saying scrap the bill. We're saying that amend those sections of the bill that crowd out the private sector, that create a single fund to manage healthcare in this country under the auspices of government. Because one, it's not feasible. It's just, we know what the previous history of managing institutions are in government. And secondly, it's not necessary, because we believe that the public and private healthcare can work together to create an environment and structures under the auspices of the bill to achieve universal healthcare.
The fear of some stakeholders regarding the NHI Act stems from inadequate governance and the Department of Health's inability to manage its budget effectively and efficiently. According to damning audit findings, some provincial health agencies have struggled to spend their money despite the deteriorating condition of some critical public healthcare facilities. How the NHI will work and be funded remains to be seen. It's still very vague whether we will be taxed more. The NHI will provide health services through purchasing of a set of health packages from health facilities and service providers contracted to the NHI fund. Health services that are not included in the NHI can be insured privately through medical schemes. And the NHI fund, which will be an autonomous public entity, will fund it through a board and various governance structures as required by the Public Finance Management Act, PFMA, and details around its financing plans and costing for the NHI remain vague at best. This is a major concern. We hear that there are 3 major court cases that have currently been lodged against the NHI bill that has been signed into law. The SABC will keep a hawk's eye on these particular difficulties around the implementation of the NHI. We all agree that this new legislation will have a significant impact on the healthcare sector. Today, we explained and verified several critical data that demonstrate unequal access to quality healthcare, which led to the implementation of the NHI Act. Is the government going about it correctly? Only time will tell. But those sitting at home whom are anticipating and anxious whether the finance minister will be taxing them more, it's not yet clear. There have been some proposals on the table to tax South Africans who are working to fund this particular NHI Act into law now that has been signed by the president. But those sitting at home who are still confused, we are still nonetheless clearer on how this particular NHI will be funded, except that solidarity fund that has been set up by the president, which will have its board and governance structures to fund partially this NHI. But as the government has said, it will be implemented incrementally.
Yes, and we understand there are two last phases. Samkele, thank you very much for that explainer. Indeed, there are many questions, but what is certain, as we've seen with the data, that the inequity is most certainly there. Thank you very much again. Second installment of Explain and Verify with Samkele Maseko there.